Hi there, my name is Dr. Steven Shoshany. I'm a chiropractor here in New York City. Today I want to talk a little bit about airplane travel and back pain. Practicing in New York City for over 20 years, one of the most common types of person I see are people that fly in from overseas or from the West Coast and they come to New York and their back goes out. I've had concierges from all the hotels refer me patients for many years, but what I want to talk about today is how to prevent this problem from happening, and if you have this problem, how to fix it. So what is it specifically about traveling or flying that makes our back worse? Well, the first, I think, has a lot to do with the altitude and the recycled air and the fact that it's really dry up there, so our joints kind of don't like that. And also it's a long extended periods of sitting, so sitting is kind of like the new smoking. We can't be sitting for long periods of time. So one of the easiest fixes you could do for the lower back is when you get your pillow, if you get your pillow, put it behind your lower back. What that's going to do, it's going to help maintain that lordosis or that curve in your lower back that'll help disperse the weight evenly throughout your discs. That'd be for the lower back. The neck, obviously you see people travel with a neck pillow. That really will help out preventing patients from getting their neck in that kinked position that happens all too often. If you don't have access to that pillow, grab one of the blankets and make it support your neck. You don't want your head too far forward, but you don't want your head flopping from side to side when you're traveling for long periods of time. I have my own routine because I travel back and forth to the West Coast frequently, and that would be number one, make sure you stay very hydrated. Drink lots of water, try to avoid alcohol if at all possible, and before you get on board, the psoas muscle, which is the hip flexor, needs to be stretched and your hamstrings need to be stretched. I want to talk about the top 3 exercises I like to do personally before I get on a long journey. The first one would be the iliopsoas stretch. The second one would be the glute med and glute max activation. And the third would be a hamstring stretch. So not really more an exercise, more stretch. So the first stretch is the iliopsoas stretch or the hip flexor. What I like to do is have my pelvis square facing straight ahead, have my arms straight up, and lean into it. I should feel a pull along the front. I don't want to bounce, I just want to kind of lean and pull in. This is something I like to do an hour or two before I board the plane. This is a glute activation, real simple glute kickback. Kick back, and even kick out to the side, and kick back, just to get some blood back to those glutes and get them firing. So for a simple hamstring stretch, cross one leg in front of the other, keeping the knees straight, and very slowly grabbing something and holding for 10 to 15 seconds, stretching the back hamstring. With these exercises and stretches, you should be able to prevent most flight-related injuries. And if you are injured and you're in New York, come visit me. Or if you're not in New York, simply type on Google chiropractor your area and you'll find a chiropractor that could be able to help you with these problems. You'll get back to doing the things you like to do quicker than if you were to not do anything at all or take medication.